Hello, everybody. I'm assuming because you are watching this video that you are a Medicare beneficiary, which means you are age 65 and older, or you're on Medicare due to a disability. This video is meant for you to help you get the information you need for 2025 to make good decisions. My name is Kelly Jo Greiner, and I am staff to the Minnesota Board on Aging and the Senior Linkage Line Service. The Senior Linkage Line is a statewide service that provides help to Medicare beneficiaries and people that are looking at long-term care options counseling, and is provided by 6 area agencies on aging in partnership with the Board on Aging. We cover all 87 counties of Minnesota, and our service is free. We don't charge anything. It is neutral and it's objective. We do not sell, market, or endorse any product whatsoever. The information that you get from us is truly free, neutral, and objective, and we pride ourselves on that and have been doing this service since 1993. There are 4 different ways that you can connect with us at the Senior Linkage Line. The first thing is to call us at our 1-800-333-2433 number. We have in-person meetings at various community sites around the state, and we also do in-person visits with individuals that are looking at long-term care options that want to remain in their home. We also provide help via online, and we'll see our website in just a minute. And then we also do chat on our website. So this is the Senior Linkage Line website. This is our first page you go to. And if you look, you will see there is a button right up here that says, it's in black, and it says chat with us. You select that button and you'll be able to engage in a live chat with Senior Linkage Line staff. If it is after hours, and our hours are 8 a.m. to 4:30, Monday through Friday, you will be able to leave an email and a staff will get back to you the next day. The website also provides an opportunity to get Medicare information updates on a regular basis. We've created this Medicare email update page that people can subscribe to, and it's open to anybody. And we will send out the most up-to-date current information intended for Minnesota Medicare beneficiaries. The link to this is on that Senior Linkage Line website page I just showed you. And all you have to do is put your email address in and you will begin getting the email updates. We don't send them out every day. During open enrollment, we send them out once a week. Otherwise, they're monthly. So you're not going to get inundated with a lot of Medicare emails from us. The newest service that we have started providing at Senior Linkage Line is a way for you to make an online referral to Senior Linkage Line. By selecting the Help for Older Adults option, you can fill out a form online and a Senior Linkage Line staff will get back in touch with you. This is a perfect thing for caregivers to use or for seniors themselves or older adults to use if they want somebody from the Senior Linkage Line to follow up with them, no matter what their issue of or area of question may be. The next thing we're going to get into is actually talking about Medicare. And the first thing I want to talk about is open enrollment, which begins October 15th of every year and ends on December 7th of every year. In Minnesota, you see there is a list that you see on this slide of a number of different plan changes. And in Minnesota, we are seeing plan changes in all of these. We're seeing changes in premiums, deductibles, providers that are participating with plans. There are a lot of changes with that happening in Minnesota. We're seeing a lot of changes in formularies, which are the covered medications. We're seeing more restrictions that people have to, for example, do step therapy. They have to try a less costly medication before their higher cost medication will be covered. The out-of-pocket costs are changing, and a lot of that is for the better, as you will see as we get more into the details. The covered benefits and restrictions are changing, and the coverage areas are changing as well in many of the plans. So during Medicare enrollment, there's a number of decisions that you have to make depending on which of these three categories you are in. If you have original Medicare, which is Medicare Part A and B, and usually a Medicare Part plan, you can join a Medicare Advantage plan, you can join drop or change Part D plans, or you can choose to stay with original Medicare. The other option is if you are enrolled in a Medicare Advantage plan, you can change to a different plan. You can switch to original Medicare Part A and B with or without a Part D plan, or you can stay with your current Medicare Advantage plan and not make a change. We also have a third advantage in Minnesota that many states do not have, and they are called cost plans. And these are plans that are only available in 21 counties of Minnesota. And they allow people that are enrolled in these plans to have both original Medicare and then coverage through the cost plan managed care network. A couple of things to keep in mind if you're looking at Medicare Advantage plans as your option is there's a couple of requirements. And the first one is that you have to have Medicare Part A and B both. If you only have A or you only have Part B, you will not be able to enroll in a Medicare Advantage plan. If you choose to enroll in Medicare Advantage, you're going to have to still pay your Medicare Part B premium. A lot of people think that when they enroll in this plan, they don't have to continue paying that, and you will have to continue to pay that Part B premium. You can see the remaining options on here or eligibility requirements. The one thing I do want to mention is that you cannot have a Medigap policy or a Medicare supplemental policy and be enrolled in a Medicare Advantage plan at the same time. One of the key things to remember about Medicare Advantage and the difference with original Medicare is that under Medicare Advantage, the only payer of any of the Medicare-related services you receive can be the Medicare Advantage plan. It cannot be original Medicare Part A and B. So you need to make sure that you're using the provider network that participates with the plan to have the lowest out-of-pocket costs. This is something that we haven't talked to Medicare beneficiaries about enough. And one of the most important things to know is that every Medicare Advantage plan and Part D plan is required by Medicare to have a website. And the website has to include comprehensive information about that plan, including the drugs that are covered, the provider network, the information of additional phone numbers to call if you have questions, as well as the actual full document that outlines what the Medicare Advantage plan is, what it costs, and what it's going to cover. They have by far the most comprehensive information that is available. It's a lot more information you will get about the plan you're looking at than going to the Medicare.gov plan finder. If you are, however, looking for the plan number and website and you don't have that information, you can get that from the Medicare Plan Finder. So basically what we're telling you is go to the plan website, especially once you've made a decision on what plan you think you want to enroll in, because you're going to want to check on these things to make sure it is the best plan possible for you in 2025. We know everybody gets inundated with mail once open enrollment is close to starting. And every year, the current plan you're enrolled in is going to send you an annual notice of coverage or an ANOC document. Please open that and review it. Don't toss it aside. Any information you get from your current plan and from Medicare, you should make sure to open and read because it's going to be critical information you need to know about what's going to happen in 2025. I mentioned earlier the cost plans, and these are the 21 counties where these plans are available, the ones that you see in green. and they are primarily in northeastern Minnesota and then a few that are scattered in the southern part of the state. So moving along, we've got the Medicare Advantage open enrollment period, and a lot of people aren't even aware of this one. We have open enrollment period from October 15th to December 7th, but then there also is a Medicare Advantage open enrollment period for people that begin the new year enrolled in a Medicare Advantage plan. It starts on January 1st and it ends on March 31st of every year. So if you're enrolled in a Medicare Advantage plan and you decide it's not working out for you, you want to make a change to a different plan, you want to go back to original Medicare, whatever your decision may be during this time period, you can make that decision and no longer have the current Medicare Advantage plan you are enrolled in. You can change, as I said, to original Medicare and a standalone Part D plan during this time period, or you can choose another Medicare Advantage plan. The important thing to remember about this is that this only applies to people that start the new year enrolled in a Medicare Advantage plan. Does not work for people that are in original Medicare as of 1/1/2025. One of the things you're going to see this year that is very different is you're going to see a revised Medicare Part D explanation of benefits. And this is something that has to be sent out by the prescription drug plan if you have had any prescription drugs filled the month before. And this is going to be something you will start to see in the mail as of January 2025. So what are the things you need to consider when you're looking at Medicare open enrollment? You want to make sure that you weigh the coverage versus the cost of original Medicare. If you're a snowbird, if you do a lot of traveling, you're going to want to think long and hard about what option is best for you. Because if you are going to be outside of the Medicare Advantage plan network, your out-of-pocket costs are going to be higher in most situations. Original Medicare allows you to see any Medicare provider that participates in the Medicare program. So those are a couple of just the pros and the cons to keep in mind and be aware of as you make your decision. You have to determine what plan services are going to be provided, what providers are going to participate with that plan. If there are providers you're seeing that you want to be able to continue to see in January 2025 and the following months, you need to make sure the plan that you are enrolling in has those providers in their network. If not, you are going to have to pay much more out of pocket, and a lot more than you probably are going to want to have to pay. You should know what the complaint, grievance, and appeals process is. Every plan has to have these in place. And know what the coverage is for additional services known as supplemental services or supplemental benefits that some of the Medicare Advantage plans do provide. And it's important to know if you're interested in things like dental and hearing aids and vision and exercise programs, things like that, you're going to want to find out if the plan covers anything related to that. Understand your out-of-pocket costs. Every Medicare Advantage plan has something called the MOOP, the Medicare Out-of-Pocket maximum out-of-pocket costs. And this is something every one of the Medicare Advantage plans does have in place. It does not, however, include your prescription drug costs. This is where you go to get the majority of your Medicare information and try to figure out which plan is going to be best for you. The Medicare Plan Finder tool at www.medicare.gov is going to help you look at the best options for you in terms of what drugs you're taking and what pharmacy you want to use. The one thing the Plan Finder tool cannot do is it cannot tell you which providers participate in the plan's network. They will just be able to tell you the pharmacies, and that is the only provider network that is included in the tool. One of the other things to keep in mind as you're using the tool is to set up a personalized account. That way you will only have to enter in your medications one time. You will get all the information about what programs you're already enrolled in and may be eligible for. And that information will stay within Medicare.gov with a secure username and password. If you use the general search, all of that information you enter in is going to disappear the minute you log out of the Medicare.gov website. So that's why we really encourage people to do a personalized search so you don't have to re-enter your drugs every single time. So when you create a Medicare account, when you create that personalized account, what you're able to do is you can compare both drug and Medicare Advantage plans side by side, and it will include your personal data and your prescription drug list. You can modify your drug list. You can save those changes. We know people's prescription drugs can change on a monthly basis, if not more frequently, where the dosage may change, where a drug may be discontinued and a new drug added. You'll be able to get those into the Medicare.gov tool very easily if you have a personalized account. And it will also show you if you qualify for any of the programs that help with the costs to have your Medicare Part D plan or Medicare Advantage plan. There is a program that is called Extra Help for Medicare Part D, which helps pay for the Medicare Part D prescription drug costs. And it's known as Extra Help or Low Income Subsidy. And as you can see here, these are the income and asset guidelines for this program. If you think you may be eligible, we encourage you to apply by going to the Social Security website or calling the senior linkage line, and we can assist you with applying if you don't have internet access or you don't have a computer. This program can help you save literally hundreds of dollars a year. The problem we run into is most people aren't even aware of it. So please apply if it looks like you may be eligible. These income guidelines usually change in February of every year. The second program that can help pay your Medicare costs are known as the Medicare Savings Programs, and there are 3 of them. There's the Qualified Medicare Beneficiary, the Specified Low-Income Medicare Beneficiary, and the Qualified Individual. These programs help pay for your Medicare Part B premiums, deductibles, coinsurance, and copays. And they are income-based, and we've put the income guidelines in this table so you can see what they are. If it looks like you may be eligible, we encourage you to apply. Application is made through your county, or you can call the senior linkage line for assistance with applying or to get an application form mailed to you. Couple other things that are happening in Minnesota that you need to be aware of that may change as we get closer to the end of the open enrollment period. Right now, as it stands, we have providers that have withdrawn from specific plans in Minnesota. The first provider is Avera Health, and they are no longer going to participate with Humana Medicare Advantage plans as of 1/1/2025. This primarily is going to affect Southwest Minnesota. Essentia Healthcare System will no longer participate with Humana or United Healthcare, and they are primarily located in northern Minnesota and northern Wisconsin. The Fairview Healthcare System for some time now, not just starting this year, has not participated with the Humana Medicare Advantage plans, and this is a statewide impact. Then we've got Health Partners, which will no longer participate with United Healthcare as of January 1st, 2025. This is a statewide impact and also affects 30,000 Ramsey County retirees. Then we have Sanford Health, that is not going to participate with Humana, and this primarily is in Western Minnesota. What may happen is these providers and health plans may negotiate a settlement where the providers make the decision they will be back in the network. We don't know if that's going to happen. We don't know what is happening with negotiations, but should it happen and a beneficiary has already changed plans for 2025, they can use that Medicare Advantage open enrollment period from January 1st to March 31st to enroll back in their previous plan if they choose to, and use those providers that they want to continue to be able to use. We are not encouraging people to wait until the end of open enrollment, until we get close to the end to make a decision, because we know how busy 1-800-Medicare gets. We know how busy Senior Linkage Line gets. And we would hate to see you miss the open enrollment deadline of December 7th. So make a decision, enroll in a plan for 2025 with the understanding if you want to go back to the Medicare Advantage plan you are in currently, you can do that during the Medicare Advantage open enrollment period. There are some plans that are leaving Minnesota counties, and one of the plans that is leaving is United Healthcare. They are pulling out of some Minnesota counties, and this is going to affect 6,140 Medicare beneficiaries. We are still working to get the counties that are going to be impacted by this. Beneficiaries that are affected are going to need to enroll in a new plan so they have coverage January 1st that they want. If they don't make a decision by January 1st, they will return to original Medicare, and they will again have those gaps in coverage that come with the original Medicare program. So please make sure, if you are one of these people affected, that you make a decision and enroll in a new plan for 2025. The options of what you can do are enroll in a different Medicare Advantage plan or a prescription drug plan, and you can switch from one Medicare Advantage plan to the other, which would be the one that you have currently, and you would switch to a new one. And remember, you would be returned to original Medicare if you don't enroll in another plan option. You do have a special enrollment period from December 8th through the last day in February of 2025. It's real important to be aware you have this, but chances are you're not going to want to wait to use it because you want your new plan benefits to take effect on January 1st of 2025. If you enroll in a plan after open enrollment ends, there's a very good chance it will not take effect on January 1st. So we really want people to understand the impact of this and hope that you will make a decision prior to or on the end of open enrollment, which is December 7th. We know we've been dealing with COVID-19 for a number of years. It has made changes in all of our lives. And for a while, the COVID tests were being covered by Medicare, or they were available for free of charge. And the government is going to make COVID tests once again free. You can get 4 tests free of charge by going to the covidtest.gov website. You can start doing this as of September 25th, and there is no charge. Also want to remind you about the Medicare coverage regarding COVID. There is lab tests that are associated with COVID that are covered by Medicare. And it's important to know that that is going to be covered by the Medicare Advantage plans, by original Medicare, and you aren't going to have to pay out-of-pocket costs for that. We've talked a lot about Medicare Advantage and somewhat about Original Medicare. Now we're going to really get into the details about the Medicare Prescription Drug Program, otherwise known as Medicare Part D. At the table you see in front of you is the 2025 summary of what the benefit is going to look like. And the first thing is that there will be a deductible, and we've looked at most of the plans available in Minnesota, and the vast majority of them are going to have a deductible. The deductible can be up to $590, and the requirement is that the deductible has to be paid before any of the drugs will be covered by the plan. So the deductible is the beneficiary's responsibility. In the initial coverage phase, the applicable drugs, otherwise known as the brand name drugs, the cost sharing is going to be 25% that the Medicare beneficiary is going to pay. The plan pays 65%, and the discount rate is a 10% amount. For generic drugs, the cost sharing is 25%, and the plan pays 75%. There is no longer a donut hole. The donut hole is going away, and I know a lot of us are very happy about that. This was also known as the coverage gap. It was literally thousands of dollars that beneficiaries had to pay before they would really get any catastrophic coverage for the drugs that they were taking. And then the best thing that we want to talk about is there's a $2,000 cap on prescription drug costs in 2025. Your Medicare Part D premium still has to be paid, and that is not part of the $2,000 cap. The $2,000 cap, however, does include your deductible and your cost sharings. And once it reaches $2,000, you do not pay any more throughout the calendar year. We know some people have prescription drug costs where they're going to reach that $2,000 cap in January or February, and others may not reach it at all during the year. It really depends on your medical condition and the prescription drugs that are prescribed for you to treat any conditions you may have. If you reach the catastrophic coverage phase, the plans between the plans and Medicare are going to pay the 100% costs after you've reached that $2,000 amount. So we've talked a little bit about the $2,000 cap. There's another program that starts on January 1st, 2025, and it's called the Medicare Prescription Payment Plan. And it is getting confused with the $2,000 cap. So we want to lay out this table and go through this so it explains each of the areas and how they're going to work. The $2,000 cap is the maximum a Medicare beneficiary is going to have to pay out of pocket in 2025. It starts January 1st. It is for people enrolled in a Medicare Part D plan or a Medicare Advantage plan with Part D. There is nothing a person needs to do. The cap is going to be an automatic procedure. They're not going to have to keep track on their own of their drug costs. And you will continue to pay the pharmacy when you pick up your prescription drugs if you are only doing the $2,000 cap. If you choose to do the Medicare Prescription Payment Plan, all of that changes. It isn't going to lower your cost. What it's going to do is it's going to take your Medicare drug costs and it's going to partition them out over a 12-month period. And that's what you would pay every month to your health plan or your Part D plan. This is voluntary, and you need to opt into it if you want it. And the way you opt into it is by calling your Medicare Advantage or Part D plan and saying you want the prescription drug payment plan. This is different in terms of how you're going to get your prescription drugs. You will still get your drugs at the pharmacy, but you're not going to pay anything at the pharmacy counter. You are going to instead get a bill from your plan every month for those costs, and you will pay them directly. You will not pay the pharmacy. So this is a big change that I'm sure many people are not going to be used to, but it is an option if you choose to go with this voluntary program. And this starts January 1st of 2025. This requires all of the Medicare Advantage plans and Part D plans to participate. As I said earlier, it's an optional program. You must opt into it. It is not automatic for anybody. And you may find that if you are getting any kind of the extra help for Part D programs, like the low-income subsidy, or also known as the extra help program for Part D, you may not benefit from doing this payment plan because your drug costs are low enough already that it is not going to be a benefit for you to have to spread them out over a 12-month period because they're just not high enough. And you're most likely to benefit if your drug costs are high. I want to just show you an example of the Medicare prescription payment plan. And we're going to start out by talking about Juan. Juan fills a $500 prescription every month. So you'll see Juan's costs. He is going to have all of his drug costs reach $2,000 by the end of April. So he's reached his cap. He is, however, because he's chosen the payment plan, is going to have his costs spread out over a 12-month period. So he will continue to have to pay an amount through that 12-month period that is going to vary. Let's say he gets prescription drugs and the dosage is changed, or he gets a new prescription drug prescribed to him. That is going to affect the cost that'll be paid on a monthly basis over that 12-month period. So you'll see here, it's divided among 12 months. It will total $2,000. And once it reaches that, then of course, his monthly payments are going to be done. If he reaches this sooner, then his monthly payments would end. Like, let's say he has much higher drug costs and he ends up paying the portion to the health plan by the end of September. Then that is when his payments to the plan would basically end. But this is showing you what it looks like over a 12-month period, and it is going to vary. As you can see here, it is not the same over every 12-month period, or every monthly period, excuse me. So this is the website that is going to give the information about the prescription payment plan. It's on the Medicare.gov website, and it explains the prescription payment plan, and it also has what's called a wizard, which is to help you decide if this is going to be in your best interest to apply for this and to opt into it. And this is the wizard landing page that's going to ask you a few questions. Number one, do you get help paying your drug costs? Are you involved in the extra help program? Are you enrolled in that? Are you in a Medicare saving program through the county? And there's a question about a state pharmaceutical assistance program. We do not have that in Minnesota, so you will not answer that question. And one more thing about the payment option is this will last throughout the entire year if you choose this option. It splits it up over 12 months. If you want it to begin January 1st, you will need to opt in now or before open enrollment ends in order to make sure that this is going to be put in place for you starting in January. This is the end of the Medicare 2025 update. We hope that you found this helpful, that it was beneficial, and that it'll help you make good decisions regarding your Medicare benefits that start in January of 2025. Please feel free to call the senior linkage line for assistance, and we are here to help you. If you have a computer, if you have access to the internet, we really encourage you to go to Medicare.gov, start looking at your plan options for 2025. You can even enroll in your plan off that website, and you can learn more about the prescription payment plan, as well as the $2,000 annual cap. We are very interested in getting feedback from you on what you thought about this video. Has it been helpful? Were there things we could have done differently to make it better? We want your feedback. So please go to the link that you see here on this last page of the PowerPoint and fill out a customer satisfaction survey and let us know what you think. Thank you so much for your time. And again, I hope that this has been really helpful and provided you with good information. Goodbye.